have been launched at different technical and vocational education and training colleges across the country. They're meant to help enhance health services in these institutions of higher learning. Their program is driven by Higher Health, a national agency that's devoted to student health and wellness. To discuss some of the health challenges in these institutions, we're joined by Higher Health CEO Ramneek Ahluwalia, who joins us now via Skype. Ramneek, good evening. Thank you for your time. Tell us more about these 10 fully furnished mobile clinic units. Where are they deployed and how are they going to enhance the health service at TVET colleges and universities?
Good evening to you, Clement, and everyone. Thank you. Absolutely, our historically disadvantaged universities, our TVET colleges, our CET colleges are very much embedded into our communities, in our rural areas. Deep down, you go to Bizana, you go to Ladysmith, areas which do not have very good access to healthcare for these students. Our intention is the students focus on their exams, on studies and graduation, and because our economy depends on them, and every hope of a mother depends on these people who are in our institutions to get those adequate skills so that they can go out to work. So our intention is how can we bring easy access to health, easy access to HIV, ARVs, contraception to young girls to fight teenage pregnancies, gender-based violence. How do we bring psychosocial support at the doorsteps? Mental health is a huge pandemic for us, fighting substance abuse, non-communicable diseases. And of course, now COVID-19, the tracking and tracing system, and getting our early screenings done for our young students so that easy access to them is at the doorsteps.
Yeah. What kind of health services then will the fleet be providing for the students? Are there specific health professionals that will be deployed on the campuses?
Absolutely. We've already deployed primary healthcare workers in the form of community healthcare workers all across our country. In almost every campus around the TVET, universities, and now we'll be moving very intensively to our 1,800 campuses in our CET colleges. But what they do is they do primary level of screening. They do primary screenings of COVID or gender-based violence, mental health, HIV. And then we are now deploying the secondary level of healthcare in the form of nurses, psychologists, social workers, and extra community healthcare workers that will come into these fully furnished mobile clinics and go into the doorsteps of our young students, and any referrals that will come through our primary level of screenings will be then taken to the secondary and tertiary level of healthcare. It is also to assist Department of Health and also our students just to bridge that relationship so that students don't have to walk 10 kilometers leaving their classes, and we can bring easy access of health to them at the doorsteps. And that's exactly where we want to end up.
Your focus is obviously on historically disadvantaged and rural campuses. How difficult has it been for the colleges and campuses to provide that critical health care?
See, the reality of South Africa is we got two South Africa in the same South Africa. Most of our students, in fact, 95% of our TVET students, or 80% of our university students, and probably 100% of our community education training college students come from very poor backgrounds, most of disadvantaged families from deep rural areas. And our campuses are built in rural communities to support rural setup for skills development, which is around the industry specific. Look at the whole Zululand with the fishery industry. Look at the mining belt of Northwest. So the aim is, how do we bring access of health while the students are studying in their young lives and grappled with so many epidemics around them. And the aim is, our intention eventually, our final goal is a healthy graduate, a successful graduate, and an economy that depends on this new generation. So the aim is to all group them up by bringing the service at the doorstep. So it is challenging. Rural areas, our basic healthcare system, our public healthcare system is swamped. And we've got two South Africa, so we need to bridge our relationships and build a sound public system. So very much similar to our national health system that we are trying to build, or national health insurance.
Yeah, I want you to tell us also about the health check, which was launched in June, because that's something else that's important. How many sort of checks have you done since then, and what does that tell you about the behavior of students during lockdown?
we've done 5 million screenings for our students through Health Check. Totally free on USSD, available on WhatsApp, web form. The aim was to get easy access for screening. You probably, all the viewers know now more about COVID, but COVID is primarily a virus which has now taken a human-to-human transmission. And the only way is to prevent it. And the best way to prevent is if we can screen people on daily basis, if people can isolate themselves at early stages, or we can isolate them at very early stages, even if they are mildly symptomatic, or we pick up the first symptom of the algorithm, we can actually minimize the spread of the infection quite intensively. So the deployment of Health Check is for daily screenings of COVID-19 every day. Besides that, we've got about 3,200 student volunteers and about 21,000 frontline workers deployed across our higher education, fully capacitated towards prevention on COVID. And all COVID needs is prevention at this stage. It's very easy to kill this virus through cleaning, sanitizing, or wearing masks, because the virus do not spread to the level, the way we think in its infectivity, if we can take measures. So the aim is to put all these measures together so that we limit the spread of the virus and we save lives as far as possible and open our campuses.
We're now moving to level 1 lockdown next month. There will be, more movement on campuses and everywhere, quite frankly. How ready are higher learning institutions? The virus is still with us. If we let our guard down, things may get worse. Are there protocols in place to manage possible cluster outbreaks?
Absolutely. In fact, just about last week, we released a protocol on cluster outbreaks. If you found 2 or 7 students at the same time becoming positive on the same day, how do we not shut down the institution? Or questions about how do we manage the cases which are now becoming positive so that early contact tracing can take place? Do we have enough residence facilities for isolation or quarantine, as we call them, for our campus students when they will be coming? All over the world, it's clearly seen. In fact, in US, if you read, the reality is when campus life starts, the students are young. Most of them will be asymptomatic, but they will be the carriers of this virus to the elderly or to the other students who will be peer with comorbid conditions, which can lead to fatalities. And you're absolutely right. The virus is growing while the economy needs to get our level lockdown 1. As a country, we are prepared both in the health system and higher education. As I spoke about, 22,000 workers have been developed by higher health, frontline workers all across our institutions, fully capacitated on understanding the protocols, the guidelines, and to be able to implement them on campuses, which includes security, cleaning, wardens, resident officers, our academia in general. So we have put measures, but the real test will be our social compact. What will be the social compact between our behavior, our students, our staff, how they understand that preventing, taking care of themselves is about taking care of the other. And I think that's where we're going with the notion, and that's why we're developing student volunteers, we're developing staff volunteers, so that we spread this message as far as possible. And I thank eNCA for sending this message repeatedly to all our parents, to all our students at home, that social compact is very critical for us if we want to curb this virus and we open our economy.
Ramneek, let me thank you this evening. Ramneek Ahluwalia is the Higher Health CEO. Everyone must pull together to